inject our guest here, beautiful lady, into her crow's feet. We already had this injection before. If you can get close here, there's a vein here, so I'm gonna try to avoid so that we don't bruise here. So that's very important. Uh, and then we're gonna do some filler as well. Okay, give me a big smile. Okay, you can relax. So I'm gonna put 10 units. I'm gonna distribute differently, and each patient is different. Here I'm gonna put in 2. And then here's the main crease, so I'm gonna put 4 here. As I said, I customize my injections. And then another 2 here. This is the vein. I don't know if you can see it, but avoid it. I'm behind it so that we don't bruise, as I said. 2 here, and then another 2 a little behind, so that if there's any lines going back, we'll also cover them. So this is the right side, and you can see we didn't bruise here, although she has a lot of veins, so just by being careful. I like to apply a little pressure always, and when I apply it down and away from the eye. So I'm applying it in a special way. Okay, that looks good. So if you can see the bumps, a little skin wheals, sometimes they have redness. That goes away within ½ hour to 1 hour. So that's okay. Right? I'm gonna go to the other side.
The first time, it really went away super fast.
Really?
Yeah.
Good. So it worked within what, 1-2 days?
Oh yeah.
Awesome. Yeah, it works usually in 2-3 days. Some people, as she's saying, it just works faster on them, We're gonna be the same then. There's a vessel here, a little vein. Try to go behind it. 2 here. And then this is the main grease, so let's just do 4 units here. Okay, and then there's the vein here. I'm gonna keep behind it again. Another 2 here, and then another 2 in the back. Okay, and the same thing. There's no bruise, there's nothing. Apply pressure. So the Botox will start working in 2 to 3 days, and as you see, in some people it does work faster. Some people swear that it actually starts working on them within an hour. And I've seen this before. But I tell my patients 2 to 3 because that's the majority, And then it keeps kicking in and keeps getting better up to 10 days, even 2 weeks. So I usually tell my patients, even if they feel they need more, we're gonna wait a little bit, because by the end of this, the first 10 days, 2 weeks, they might not even need. And we're like, oh, okay, now I'm fine. So if we need to do touch-up, usually I wait for around 2 weeks, if needed. And then it will last between 2 months to 6 months. In most people, it's 3 to 4 months. So people usually need it 3 times a year or 4 times a year. So that's about the crow's feet we did. The other thing that we're gonna address today is the nasolabial fold. We start from the corner of the mouth, goes down. Some people, they call them smile lines or nasolabial folds. There's actually an article in my website, I believe either under conditions section or under the blog, which is the different things that you can do for the nasolabial fold. Different things from cheekbone fillers, fillers directly into this area, thread lift, radiofrequency microneedling, all that helps. And of course, the basic stuff I always tell my patients, we shouldn't always jump to very advanced treatment and forget always the basic ones, from avoiding the sun, sunblock, and regular facial, all that stuff. That's all very important to keep the results, and keep things natural as well. So now we're gonna shift and throw the Botox needle away. And then the filler today, we are going to use Versa. Versa is a hyaluronic acid filler. I use it a lot in my practice because it's really a good filler. Under the microscope, the spheres of the filler are spherical, and they have almost zero incidence, or to my knowledge actually zero incidence of what is called nodules. Nodules are kind of small balls that can, as side effects with some fillers, can develop under the skin. It's really hard to get rid of them when they develop with Versa. And there's, after 3 or 4 million injections, there is no reported incident of nodular formation with this filler. Another good thing I like about Versa, actually, most of the fillers, the hyaluronic acid fillers especially, they come as 1 cc. If you look here, it's 1.2 cc. So it has 20% more volume, you know, than the other syringes and other fillers. So that's another advantage of Versa. So I already disinfected here, but I'm gonna do it again just to make sure. Okay. So in here, as you see, there's no really lines or wrinkles. It's more the fold that bother hair, not the lines. So in here, I can be a little bit deeper. Some people, when come to me in this area, and they have actual lines, okay, kind of wrinkles in that area. So to get rid of that, I have to be really superficial to improve that area. But if there's only fold, as in her case, I don't have to be too superficial. I can be a little bit deeper and it will give her really good results. I like the bevel of the needle as well, up. And we go like this. The filler has lidocaine in it, numbing medicine. So as I'm injecting the filler, I'm also injecting a little numbing medicine. Okay, I go a little deep, I go all the way in. I aspirate, there's nothing, no blood. Okay, and I start injecting as I'm going out. Okay, a little bit, and then I just keep going down and injecting the whole area. Sometimes I can mold it to smoothen it out if I need to. Okay, looks good. Okay, let's see what happened here. Okay. And if I look, I always like to try to look, you know, inject the 0.4 out of the 1.2. Maybe I inject another 0.2 and then we'll go to the other side. I try to be, you know, inject the same amount in both sides. So to keep things symmetrical, you know. Sometimes, you know, we need to inject a little bit more on one side than the others. But I always tell my patients, you know, it's just, there's no point in trying to be 100% symmetrical. No one in the world is 100% symmetrical. So a little asymmetry is fine. If the asymmetry is really very significant, then we'll try to, and we'll start to address it. If it is not, then we'll just leave it alone, you know. Otherwise, you start chasing your tail, you know, and that's not also good. Okay, so it's already, you can see that the fall is way better. And then I can inject a little more and one last time here. Okay, so that's around. Okay. And because we injected it deep, we really don't need to mold it much, you know. So I'll just apply a little pressure to stop the skin bleed, you know, which is expected. But that usually skin bleeds do not bruise, you know. If you inject any vessels, you go through a vein that is a little deeper than that bruise, but not the skin bleeding, you know. So we're applying a little pressure. You can see it's really nice and smooth. That's what I like about Versa, you know, it's very nice, very natural. Okay, go to the other side.
I'm excited to see it.
Yeah, we'll show it to you. We just need to get the, I'll get the mirror from the other room. Okay, awesome. Try to get the bevel up. Have like around 0.6. Okay, this area, try aspirate, negative, and then we just try start injecting in retrograde, which means as I'm coming out, I'm injecting the filler. Okay, that's good. The first few injections are a little bit more painful because, you know, we're just starting and there's no numbing medicine there. As we do more injections, we'll start to have, you know, as I said, this filler has a lidocaine numbing medicine in it, so I'm injecting both filler and numbing medicine. So it becomes easier as I.
It's very quick too. It's like a little shock and then that's it.
That's
It's
all.
gone.
Awesome. So with these lines, I always tell my patients we're trying to soften them and make them a little bit less deep. We're not trying to take them away completely because remember, I will say even babies have these lines. You see what I mean? So we're not trying to efface them and erase them completely. Then it becomes unnatural. We're just trying to make them less deep. That's all what we're doing. And this is filler, you know, and we're doing one syringe. We can always do more. I tell my patients, you know, there's no rule that, you know, this certain area is one syringe, 1.5 syringe. It all depends how much we need. You know, so there's certain areas you have to be more conservative than others. Like when you're doing tear trough fillers, you have to be really careful not to overdo it. But you know, a lot of the other areas you just keep adding until you're like you and the patients is like satisfied and they achieve what they're trying to achieve. Okay, it looks really nice already. And then we can go a little bit here again. And you can see that didn't have much discomfort this time because the area is kind of numb. Partially at least. Here. One
Yeah, I
last.
barely felt that one.
Good. All right, that's the last injection and we're done. I always like to communicate with my patient, you know, they like to know what's happening, you know, and when they get them done and all that stuff. So the same thing, we'll apply pressure here, and then we're finished.
I love that you do that too because I'm getting an education on what's happening.
Awesome.
As well as, you know, applying pressure in this, but you really give me a lot of information about what's going
Absolutely,
on.
you know, it's very important to understand, you know, because the patients don't know what's normal, what's not normal, what to expect and all that stuff, you know, so that's why, you know, I'll tell them I'm always here before, during, and even after. If there's any questions, any concerns, you know, I'm always available by phone or by email, you know. Best thing even after hours is the email. During hours, call us. Or you can even walk in if there's any real concern after any injection. Can you hold this for 1 second for me?
Sure.
I'm just gonna get